Hello everyone, welcome back to Last Night Dentistry. Today we are going to discuss a very important and extremely high yield topic in oral pathology and endodontics known as pulpitis. Pulpitis is the inflammation of the dental pulp tissue. It is one of the most common diagnostic challenges that clinicians face daily. The key decision we have to make is whether the pulpitis is reversible or irreversible because they decide whether we restore the tooth conservatively, perform root canal treatment, or extract the tooth. This topic is very important for your BDS exams, FCPS exam, ADC, INBDE. Let's understand it step by step. So, pulpitis can be classified into three main categories: reversible pulpitis, irreversible pulpitis, and pulpal necrosis. The most common cause is dental caries, but other causes include trauma, cracks in the tooth, bruxism, and iatrogenic factors like deep cavity preparation or heat generation during restoration. Because the bulb is enclosed in a rigid chamber with limited blood supply, even mild inflammation can quickly become serious. Moving to the next slide, let's start with reversible pulpitis. This is the mildest form, where the pulp is inflamed but still capable of full recovery if the irritant is removed. The pain is sharp and intense, triggered by cold or hot stimuli, and usually lasts less than 20 minutes. There is no spontaneous pain, and the patient can easily localize the tooth. Treatment involves removing the irritant, placing a sedative base, and protecting the pulp. The pulp usually heals completely. Now, coming to irreversible pulpitis. In this stage, the pulp is severely damaged and cannot recover. The pain is spontaneous, dull, throbbing, and lasts for more than 20 minutes. It may be aggravated when the patient lies down and can sometimes be referred to other teeth or the face, making localization difficult. At this stage, the pulp must be removed through the root canal treatment or the tooth should be extracted. Here is a very important comparison table between reversible and irreversible pulpitis. In reversible pulpitis, pain is thermal induced, short lasting, and sharp. In irreversible pulpitis, pain is spontaneous, prolonged, and dull. This table is frequently asked in exams, so please memorize it. Now, next is pulpal necrosis. This is the death of the pulpal tissue. It can be infected from caries or aseptic from trauma. The tooth may initially be asymptomatic but later show grayish discoloration. There is no response to thermal or electric pulp testing but positive percussion test due to apical inflammation. Necrotic pulp can lead to periapical abscess and sinus tract formation, also called perolis. Coming on to the next slide. Diagnostic techniques. Diagnosis of pulpitis require a combination of tests. The most important is the history and nature of pain. Other tests include thermal test, electric pulp test, percussion test, radiographs, and palpation. Remember, there is no perfect correlation between clinical symptoms and exact histologic picture of the pulp. Histopathologically, reversible pulpitis shows mild vasodilation and slight inflammatory infiltrate. Irreversible pulpitis shows severe acute and chronic inflammation. In necrosis, there is total tissue death and possible bacterial invasion. However, in clinical practice, we rely more on symptoms and tests rather than guessing the exact histologic stage. Now, here are the most important high yield points for exams. Most common cause of pulpitis are dental caries. Pain in reversible pulpitis may be sharp, thermal induced less than 20 minutes. Pain in irreversible pulpitis is spontaneous, prolonged, dull. Sign of pulpal necrosis shows no response to vitality tests plus positive percussion. Treatment includes conservation with sedative dressing in reversible pulpitis, while in irreversible pulpitis, we may go for root canal treatment. Accurate diagnosis saves tooth and prevent unnecessary root canals. Here is the, you know, some let's revise with some exam style question. As I've told, most common are dental caries, and if we come on to the point that let me see here, a 34-year-old patient with sharp pain or cold fluid that resolved within 15 seconds after drinking. He is a deep disto occlusal amalgam restoration placed 2 weeks ago. Percussion and palpation yield entirely physiological response. So this shows that there is uh, because it resolved within 15 seconds, it is a case of reversible pulpitis. We will what with the management, we will go for conservative monitoring and protective sedation restoration to allow the dental pulp recovery. So what does a percussion test treatment represent? It represents that apical periodontitis inflammation has reached beyond the pulp. So these scenarios are very commonly asked in Viva and theory exams. That's all for today's lecture on pulpitis. This is a fundamental topic. Master the pain characteristics and diagnostic tests. Revise these slides multiple times. If you like the video, please like, share and subscribe. Turn on the bell icon and comment below which topic you want next. Share this with your friends preparing for exam. Thank you so much for watching. Keep studying hard and stay consistent. Take care. See you in the next video.